am Dr. Malathi, Senior Consultant in Obstetrics and Gynaecology Department in Manipal Hospital. Prior, I was working in KIMS as Head of the Department of Obstetrics and Gynaecology. Now coming to the thing, a woman, any diseases, its prevention is better than the cure. Always preventive aspects you should know, like abnormal uterine bleeding, like the woman will have normal menses, that is once in 30 days or 25 to 30 days, that is normal. But if the patient has abnormal bleeding, that is in between the menstruation, or if the bleeding is more during menstruation in duration and quantity, she has to report to the hospital. And once she passes clots in the menstrual blood, that is abnormal bleeding. Again, she has to report to the hospital where preventive measures can be taken, and even the blood levels, the thyroid levels, all those will be checked and treatment will be given. One more thing, and this abnormal uterine bleeding has different scenario in different age group. Puberty age group, it is different, and reproductive, when they are like 20 to 40 years, it is different, and above actually 40 to 50 years, it is different. And post menopause, after the menopause, any bleeding should be checked. After 45 years also, we should be cautious. So anyhow, when there is abnormal uterine bleeding, please report to the doctor, one thing. And coming to the white discharge, okay, in case if the white discharge wets the underclothes, that means it is more, you have to report. When it is blood stained, foul smelling, and when there is itching, all those things you have to report to the hospital. And especially old age group, if the white discharge is more and foul smelling, immediately they have to report to the doctor, as malignancy we have to rule out during that condition. And one more thing is polycystic ovarian disease. Now it is very common, and it is a group of symptoms actually. It's an endocrinology, it's a metabolic endocrinology and metabolic disorder. So it has a group of symptoms like obesity, abnormal sugars, abnormal blood pressure, and abnormal uterine bleeding, that is abnormal menstruation, abnormal hair growth, like this, and loss of hair, all those things. So it's a group of symptoms. So if a lady has polycystic ovaries, that is small cysts in the ovaries, sometimes they may be normal, like they will have normal menstruation, they conceive normally and they deliver. Only when we do the scanning, we think that this lady has polycystic ovaries. But many of them can have symptoms like obesity, abnormal hair growth. They can have problem in conception, problem in bleeding. They have to report to the doctor and seek the treatment. And always obesity is very important, and if you reduce the weight, most of the problem will get settled. One more thing. The other thing is, now we have this what is known as keyhole surgery. So many surgeries can be done through the keyhole, so that the mortality and the morbidity will be less. That is, hospital stay will be better, recovery will be fast. Okay, these things you should keep in mind and go for the keyhole surgery. And any tumors like abdomen becoming big and big, you have to report. There may be tumor, there may not be tumor, we don't know, but report to the doctor and get it cleared. If there is nothing, we are happy. These so many disorders, when they come in critical conditions, we have cured them, and the patients got discharged and went home with a smile face, and we have supported them here with all the nursing care, all the doctor's care, and the subordinate cares, and the patient got discharged with a smile face.